Deep set eyes. Should I get an upper eyelid surgery or a temporal brow lift? Would a temporal brow lift be better? Would I need both? Will a temporal brow lift help lift some of the cheek sagging and improve nasolabial folds? I have deep set eyes and have had a fatty, thick upper eyelid all of my life. Not sure if upper eyelid surgery alone is the right option. Will it open my eye area enough?
Thank you for your question. You submitted a photo and you stated you have deep set eyes, and your basic question is, should you get an upper eyelid blepharoplasty or a temporal brow lift? Now you're also asking additional levels to the same question about, will the temporal brow lift the cheeks and improve the nasolabial fold? Well, certainly I can share with you my overall approach to patients like yourself who come to our practice, and I'll tell you some of the things that help me guide my patients as to what I would recommend. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon, helping people improve the appearance of their eyes and their cheek area and their face is a significant part of my regular practice every day. So certainly when you ask a question like this, you can be sure that if you go to 5 doctors or 10 doctors, I mean, you'll get a different opinion, a set of opinions from each one, and it can certainly be overwhelming. What I try to really understand for my patients is, what kind of outcome are they looking for? And generally speaking, people want to look fresh, they want to look good, they want to look natural. And in the modern world where so many people have exaggerated appearance from what many people consider too much plastic surgery, there is no shortage of examples where people say to me, I don't want to look like so-and-so, I don't want to look like so-and-so. So I would say that looking at your overall appearance, when I look at your brows, my initial impression is that your brows are not too low, and therefore I would caution you about a brow lifting procedure. Now, a brow lifting procedure in the more traditional sense is a procedure that, whether it's an endoscopic brow lift or even a temporal brow lift, you're trying to get at least the tail of the brow up a certain level. Well, when you look at your photos, I would suspect that the tail of the brow may be slightly lower than it's been in the past, but I would suspect it's more likely due to a volume issue. So there might be some value in doing something a little less invasive, such as adding filler to the temporal area, as well as something like a Botox brow lift, where there is injections of Botox done to slightly elevate the brow. Now, of course, one of the downsides of that is there is maintenance involved. But I think that since the beginning of my career more than 20 years ago, I've always felt that if you really want to make someone look plastic, do an aggressive brow lift on someone whose brows are not that low. And I have to say that a lot of my colleagues really feel strongly about doing brow lifts. So it really has to be a match between the doctor's aesthetics, patient's aesthetics. That being said, I would suggest that you also think about whether or not you're dealing with sagging versus volume loss when you're talking about the cheek area and the nasolabial fold. One of the most common things that we have shifted in our overall approach is perception of what is sagging versus what is the result of volume loss. In the beginning of my career as a surgeon, our goal was always to lift things because tissues would sag, and the options were more limited. Now, move the clock forward, we can actually do a lot more and still get really nice outcomes without doing aggressive surgical procedures. Now, I do a lot of facelifts, and I do a lot of the classic cosmetic procedures in the face for facial aging. But I have found that for someone like yourself, a conservative approach may be optimal. And this may include something like an upper eyelid blepharoplasty, where a small amount of skin and the hooding area on the side is reduced. And depending on whether or not the eyelids look low to you and looking at what you look like in the past, there may be some other options to explore. Now, that being said, the other areas that we typically enhance, such as the areas that you're concerned about, like the cheek, nasolabial fold, we actually do a lot with something called structural volumizing. Structural volumizing means placement of long-lasting fillers at a deeper level along the bone structure, so that when the filler is placed, the bone structure is restored. One of the least appreciated things that is overlooked by both patients and surgeons is that bone loss is a significant part of facial aging, and that causes the face to go inward and the tissue to kind of go downward and inward. So restoring volume actually plays a big role. So I think that it's important to get a full assessment in order to really understand what is optimal for you. When I evaluate my patients, I take photos from multiple angles, I review everything with them, and I try to help them understand what's the difference between sagging versus volume loss. And then we come together and work on a plan that will be optimal for them. So meet with qualified, experienced cosmetic surgeons. Take good notes and don't get overwhelmed by the many different opinions that you will probably receive, and figure out what, you have to be in the driver's seat. You have to decide what will look right for you and what level of invasiveness you're most comfortable with. But ultimately, understanding the problem defines the solution. So I hope that was helpful. I wish you the best of luck, and thank you for your question.